Welcome to this new episode of This Week in Digital Health. My name is Aline Noizet and I'm your host. In each episode, we have insightful discussions with international experts from digital health ecosystem about trends in digital health, about the present and future of healthcare, about innovation, and about what makes our guests wake up in the morning. Today, it's my pleasure to welcome Pascal Lardier, founder, digital health strategist, and head content at éditohealth. Pascal, welcome.
Thank you very much, Aline, for having me.
Pascal, can you tell us a bit more about yourself? I gave a brief introduction, but tell us a bit more, please.
Well, I've always been in the production of content for the healthcare industry. When I started, health IT was important, but it was still a little bit a technical discussion. I really started being very interested in digital health, actually with you, Aline, when we started the international activities of Health 2.0.
Exactly.
And that was fun. Sorry?
It was very fun, yes.
It was very fun. And that really, boosted my energy to work more closely with startups, investors. Then HIMSS acquired Health 2.0, unfortunately. And the hope that I had joining HIMSS was that we would actually bring two worlds together that needed to collide. One, the world of innovators and investors, and the other one, a world of hospital decision makers or just decision makers from the healthcare industry in general. Well, that didn't really happen, unfortunately. But it got me a better understanding of the hospital and health systems and why it's so difficult a world to penetrate and to get your foot in. Now I'm back as a consultant, as founder of éditohealth, and I'm delighted that we're having that conversation today.
And me too. So Pascal, you just mentioned, so you've been in that space for a long time. Like, yeah, you and I have been working together on conferences and other projects. Can you share a bit like the evolutions that you've seen in the industry over the years?
So if we want to really strictly talk about the health innovation ecosystem, since the days that you and I worked on Health 2.0 International, I would say that the industry has matured as a whole tremendously. First of all, we learned the hard way how complex the healthcare industry is. We recognize the importance of co-design. At the beginning, you and I have put people on stage who just had a bright idea, but they had developed something without consulting patients, without consulting the end users from the hospital side also. So a lot of these companies quickly realized that this is something that's needed to happen, co-design. And actually, the discussion moved, and I would say thankfully, from disruption to co-design. Then I think we're now in a period where it's less about intense innovation and more on what do we do with the technologies that we have and that have proven to improve clinical or financial or both outcomes. So obviously, in this new environment, evidence is on everybody's lips. We also have new evaluation and certification frameworks that are appearing to facilitate and accelerate adoption at national levels. And we've also seen a lot of incentives for the hospital systems to adopt some of these technologies. I think where we're still lacking a little steam is the enthusiasm of the clinicians. But I mean, this is a big topic, I would say.
I think even with that, we've seen things move. I remember at that conference in London, maybe one of the first Health 2.0 that I did, where the question was on stage, like, how can I reach the hospitals? And now it's something much more mainstream than it was like 10 years ago, for instance.
Well, the innovation ecosystem has really gathered around these innovators. And now we see more and more hospital systems that have their own fund for digital health. They also have their own incubators or accelerator. The collaboration starts a lot earlier. And I think again, it's about co-creation. And once you have this pre-established relationship with hospitals, it gets a lot easier to be more aligned with their exact needs. I don't remember who says that, but I remember the sentence, when you know one hospital, you know one hospital. They're all very different. They all have very different requirements. And so getting close to the key stakeholders in them is very important. One thing that we've seen also in recent years is the rise of new job titles. I think at the time that you and I started, the Chief Clinical Information Officer title did not exist. We didn't have Chief Patient Officers either, and we didn't have Chief Data or Chief Analytics Officer. Now, all of these are very much needed, and these job titles are booming everywhere. But this is very new. And we needed, with the CCIOs, we needed someone to make the link between the clinical and the technical aspect of delivering health services. So I think that was a very important evolution in the last few years.
For sure. And Pascal, if we talk about digital health, so it's quite broad areas with different topics inside it. So which areas, topics are you most interested in within digital health?
You are right in saying that the spectrum of solutions in digital health is huge, especially if we go from health to wellness and community care and all of these. Well, actually, I would say that community care is something that is of interest to me because I have been witnessed in my life of the impact of having to care for someone. So I remember you and I building some conference sessions about caring for carers. Because when you care for someone, it takes a toll on your own health. And frankly, the doctors, when you go for your spouse or your significant other to accompany him or her at the doctor, the focus is on the patient. And maybe you'll have one question. And how about you? You're holding up, and that's it. And the result is that in some cases, like neurodegenerative diseases, it's actually not that rare that the carer dies of exhaustion before the patient. And then we encounter new problems because of that. So we need to protect carers. So I would say that everything that we're doing to support them as a community, as people who also need a lot of mental and health support. And then closely related to that, I would say that I've always been very interested in mental health solutions. I think for a couple of reasons. The first one being very personal again. I've been a patient. A mental health patient for many, many years. I've been diagnosed with a general anxiety disorder. I always had problems sleeping, a little bit mixed with that of substance abuse. I have no shame in saying that. But more importantly, I feel it in me, and I see it in others. that really mental health is where health starts. It's
That's
very
important.
difficult. Sorry?
No, that's a very important point.
Well, yes, and I think most of the time we tend to forget that a little bit. But it's difficult to ask a diabetic patient who's also someone clinically depressed to take good care of him or herself. It's very uh, difficult to ask anyone to change behaviors when there is in the background something that is fundamentally wrong in the way that you feel. So I think it is very important, and I hope actually that we will use these solutions to integrate more of mental health in the general journey of the patients. I've had an example in my family, a very young patient who was diagnosed with Crohn's disease at 11, and she had 30 minutes of a BS appointment with the hospital psychologist. What are we trying to achieve here? Are we trying to check, okay, we've done the psychology check with this patient? I think it's not enough. I think there is an opportunity to leverage these technologies um, to give a more prominent position for mental health in the general journey of the patient.
And have you seen some interesting solution that got your attention, especially in the space of mental health, an app or software that you thought, that's very interesting?
I won't give any names. I think you and I are in contact with so many startups that it wouldn't really be fair to name names. But I would say, first of all, that simple is usually beautiful. Um, so I like platforms that are very, very simple, like health loops. I think are very elegant and simple. If we go to mental health, everything that we do to support patients in between visits, I think there's a lot of technologies there that are very interesting. And in cases like, schizophrenia or, patients who are manic depressive, having something to accompany you in between visits is very, very important. Even for your discussion with your psychiatrist, if you go to an appointment and you are in a manic mood, your doctor may ask you, so have you been in the last 6 months? And if you're in a manic mood at that time, you'll say, oh, it's been fantastic. Great. Nothing to complain about. If that day you're in a depressive mood, your response will be, oh, the last 6 months have been awful. So, simple is beautiful. And in this kind of things, having just a simple journal, having to answer one simple question: how was your day? And is it a smiley face or a frowny face? Helps patients really realize that the mood of the day is not a reflection of the last 6 months, which I think is already very important.
And
That's an example I would give.
I think this is also good to identify triggers, like not only how you've been feeling,
Yes.
but maybe something specific have been triggering your mental health. And if you can work on that with your healthcare professionals, that also can move you some good steps. Yeah.
Well, some of these applications, if you put a frowny face, will ask you, did anything
Yeah.
special happen today that put you in that mood?
Yeah.
Um, but these are not very advanced technologies. I really I couldn't care less about the actual technology part. I want to know what it can improve in terms of outcomes for the patients and the health system. Um, but technology for technology, I think, is not something that is very much of interest to me.
And do you see some remaining gaps in terms of digital health solutions, like areas of digital health that are not really covered and could benefit, you think, from a technological solution?
I'm sure that there are. This being said, every time you think you may have a good idea, you Google it and you realize that some people have thought about it before you. Um, I think I think the innovation is sometimes a tweak about how it's done rather than what it does exactly. Um, so I might find some technologies that are very interesting, and there is a gap because what we have so far is lacking in terms of engagement. But maybe this new technology will have an engagement strategy that is a lot stronger. And I would say that the unmet needs at this point are with the patients, with the hospital systems, with the users. This is one thing that has changed very much in the last few years. We used to push and push technologies at hospitals, and people at hospitals were like, stop, stop. Can you please wait until we express a need? Then you can start working on it, or you can start sending us some information. But I think that um, identifying unmet needs today is really about listening to the key stakeholders and not trying to push solution, but trying to use this pool.
But maybe that's something you and I we know firsthand. It's not always easy, even for healthcare professionals, hospitals, to know their needs. Like they could use some help to identify what they needed exactly, what would be the must-have, nice-to-have features for such a solution, right?
Yes, and you and I also know that even when they think they have a need, the CIO may not be aligned with the CMO, who might not be aligned with the engagement strategist. Everybody has a point of view. And so when there is a need that is identified and we launch a search for this type of technologies, it's really important to spend a lot of time with the client, not only to listen to their need and their requirements, which are always very specific, but also to make sure that they're aligned internally, and that what the CIO wants is consistent with what the chief medical officer wants and the CCIOs and the different departments. So I think that's really important.
And so a point I would like to touch upon, a point that I like a lot, I care a lot, is like medical education, because you can have solutions that are great, that fit the market, that fit the end users. But we've seen in the market that the education is not always here, and that can be a barrier for adoption. So for healthcare professionals or for patients. So what's your take on that?
Well, first of all, I think that clinician engagement starts with, I mean, I don't want to use the word education, but training. We need to show them the advantages, the benefits of using these technologies. We're not at the army. We cannot just say, from now on, you're going to use this. Because, at the end of the day, their primary job and their primary objective is to make people's lives better. And it's not necessarily by using a technology that you might do that. It might help you, but I guess what I'm trying to say is that the engagement and the fact that they will embrace this technology starts with medical education. On that front, I think we're seeing a lot of very encouraging things happening. For instance, in France, there are some programs that are developed for continuous medical education, but also this CME modules are in line with new curriculums that are developed at the university. Other things that are happening, we're working at the moment with the European Society of Cardiology. Well, now they have a specific, and it's been running for a few years, but they have a digital health summit. It's about reaching out to and preaching out outside of the choir. If we continue to build conferences where it's digital health enthusiasts who speak to other digital health enthusiasts, yes, we will shake hands, but not much will happen. Now we need to start working with organizations like the European Society of Cardiology or the Society of Oncology. And we need to make sure that their members actually understand that there's not really a lot of choices. You will have to embrace these technologies, or maybe you won't be a doctor in the future. Not because technology will replace doctors necessarily, but even patients. At some point, I know that I prefer to have a relationship with a doctor that is equipped to prescribe digital health, or at least understand the point. And if I use something to manage a condition, I want to be able to share this information with my provider. So I think it's really important that we get closer to these medical societies because they have a very important role to play.
Absolutely. So Pascal, you mentioned European Society of Cardiology, that you were working on a project with them. Can you tell us the project you're currently working on?
Sure. So we're organizing a radical health festival in Helsinki on June 12th through the 14th. And it's actually a festival. It's not an event. And the reason why we call it a festival is because, first of all, we wanted this event to be very collaborative. Us at éditohealth, we didn't feel like we were such experts in every area of digital health to produce the program just us. So if we wanted a part of the event that was about cybersecurity, we created a partnership with the leader in that area, Health Isaac. Because we wanted to reach out to health professionals, and we thought cardiology was a good start. We partner with the European Society of Cardiology. So what we're trying to do with the festival is to build a puzzle where everybody is actually bringing their own area of expertise. So, you know, this is again collaborative and inclusive. So if you want to know more, if you want to contribute, we're very open.
And can you tell us a bit more, like can you highlight some sessions? Can you tell us some of the speakers who are going to be present?
Sure. So we just talked about the European Society of Cardiology. They're going to have a full track running for 2 days on June 13th and 14th. Then ETEL will propose some sessions about healthy living, but also on AI. They want to bring forward some interesting EU-funded projects. The ECH Alliance is going to tell us how to really make the most of health innovation ecosystems. We're going to have some areas that éditohealth focuses more specifically on. One is data and services integration. It's a big topic in Finland. They are leading the way in that area in integrating health and social services. So we thought it was important to share it with the public. We're also doing some healthy, active, and productive aging sessions. And then I would say that the things that are very new in this agenda is the collaboration with CHIME, the College of Health Information Management Executives. CHIME International is going to do 3 leadership sessions, one that is going to focus on CIOs and CCIOs, one that is going to focus on Chief Nursing Information Officer, my apologies, and the last one they will actually launch at the Radical Health Festival, and it will focus on this new job title we were talking about earlier on, Chief Data Officers. I invite you to have a look at the matrix. There's 2.5 days of programming and about 120 or 130 speakers. So it's easier to see it from the website than it is for me to explain at length what we have in store for you guys.
We'll share the link to the website and also discount code for people who didn't register yet. So you can be part of that fantastic event and part of the wake-up call.
Yes, this is the wake-up call. You know, we don't want to be pessimists for the fact of being pessimists, but the fact is we have a tendency to procrastinate with everything, whether it's climate change or the unsustainability of our health systems, or even things like antimicrobial resistance. We always postpone. There's always something that gets priority on these topics. And our point of view is that we actually need to be radical now. Otherwise, we will not have a health system in the future that will be able to protect everyone. And this is a value in Europe, which, you know, is so important.
Exactly. Well, Pascal, looking forward to the conference in Helsinki. So I've got one last question for you. I'm curious to get your opinion. So you've been involved in conferences for many years. How do you envision the future of conferences? Is it going to be back in person fully? Is it going to be hybrid? What's your take?
I think we are going to go back to conferences that are presential, in person. And if there is a hybrid format that we kind of start adopting broadly, it will be a format that is already in use today, where the people that actually come to Helsinki, well, they have access to everyone and they can shake hands and they can use the networking apps and all that stuff. And then the people who cannot travel or don't want to travel, there's also that. I think they will have the content of the conference, but bit by bit, with a release. There's a lot of conferences that always do that, that already do that, and I think this is the direction that we're going to take. But we've witnessed it right after the pandemic. Well, although I don't think we can say after the pandemic, I think we're still very much in it. But with the lowering of the restrictions, people were very happy to be able to get back together, because this human touch, I think we'll never replace.
Exactly. Well, I think that's a great way to end up that session. Pascal, thank you so much for joining me today. It was a pleasure to have you. And thank you all for listening to us. And remember that you can listen or watch us on your favorite platforms. You can visit our YouTube channel to see the previous videos with all our guests. And we see you soon. Bye-bye.
Bye, everyone.